Greetings. Let us learn about the role of Lugol's iodine in GI endoscopy. Lugol's iodine is useful for screening of squamous cell cancer of the esophagus. And if you want to know what are the different constituents of Lugol's iodine, they are iodine, potassium iodide, and water. And how do you deliver Lugol's iodine? When you perform endoscopy, and once you enter the esophagus, you take a spray catheter and prime it with a 20 cc syringe loaded with Lugol's iodine, and use the spray catheter to spray. And typically, you start at the distal esophagus and spray from the distal esophagus coming up proximally. With the spray of Lugol's iodine, the esophagus, a healthy esophagus, takes up the brown coloring or discoloration. And as you watch, if the esophagus is healthy, the squamous epithelium is healthy, it will have that brown discoloration for a while and then slowly fades off. If there are areas of abnormal epithelium, abnormal squamous epithelium, which do not take up that brown discoloration, you may see these patches of non-discolored areas. And let us understand why this happens. Lugol's iodine is an absorptive stain. And when you look at the esophagus, we know that 95% of the esophagus is lined by squamous epithelium, and the last maybe centimeter or less is lined by the columnar epithelium. And we also know the Z line or squamocolumnar junction. The squamous epithelium is loaded with glycogen, while columnar epithelium has no glycogen. The glycogen in the squamous epithelium takes up the Lugol's iodine, and a color change is seen as brown color. When the squamous epithelium gets damaged, either because of inflammation or because the cells have turned dysplastic or precancerous, again they lose glycogen. So this is important to know. Healthy squamous epithelium has a lot of glycogen. Diseased squamous epithelium has no glycogen. And when you see brown discoloration of the squamous epithelium of the esophagus, you know that it is healthy. And if you see areas that do not take up the stain and seen as islands here, you should suspect whether these are either due to inflammation or dysplastic or cancer cells that are depleted of glycogen that have not stained brown. So, Lugol's iodine is used for esophageal squamous dysplasia or esophageal squamous cell cancer detection. So what are all the conditions where you can use Lugol's iodine in the esophagus? So who are at high risk for esophageal squamous cell cancer? Asians and Africans are high, especially those in certain parts of Asia and Africa from the high-risk areas should have a chromoendoscopy at 40 years. Patients with achalasia cardia who have had achalasia for at least 10-15 years should have chromoendoscopy yearly after 10 to 15 years. Patients who have had caustic esophageal injury at least 10 to 20 years after injury should have chromoendoscopy every 2 to 3 years. And patients with head and neck cancer, squamous cell cancer of the head and neck, after they have finished the therapy, they should have screening. A rare condition called tylosis, where there is hyperpigmentation of the hands and feet, palms and soles, again are at high risk for squamous cell cancer of the esophagus. They should have 4-quadrant biopsies of the upper, middle, and distal esophagus every 1 to 3 years. So there are lots of things here. All you want to keep in mind is who is at high risk for squamous cell cancer of the esophagus. Certain populations from Asia and Africa, especially Japanese, Koreans, patients who have had achalasia for a long time, patients who have had caustic injury of the esophagus, or patients who have had head and neck cancer, and patients with a rare genetic condition called tylosis. So you can also use Lugol's iodine to screen squamous cell cancer in other parts of the body. It's not just the esophagus. It's also used for cervical cancer screening and anal cancer screening for looking at squamous cell cancer of these areas. And the principle is again the same. Squamous epithelium has a lot of glycogen. It should stain brown, and if it has any evidence of injury or damage or dysplasia, it loses glycogen and it doesn't take up the stain, doesn't show the brown discoloration. Coming to the adverse effects of Lugol's iodine, if you place the Lugol's iodine, it is an irritant, so it can cause esophagitis and gastritis. So patients who have had Lugol's iodine staining, the endoscopist typically tries to wash, clear it off, and suction all the dye in the stomach to cut down the risk of irritant esophagitis and gastritis. Patients who have had hypersensitivity or allergic reactions should avoid Lugol's iodine, and this is another side effect as well. It is important whenever you put liquid into the esophagus. Esophagus is a small chamber. It cannot contain a lot of material, and if precautions with having are not taken, sometimes it could result in aspiration pneumonia. So whenever you're trying to put some liquid into the esophagus, whether it's a dye spray, Lugol's, or any other dye spray, it's important to keep the head end of the bed up and try to spray from the distal end so that it goes into the stomach, and have a suction catheter readily available at the bedside by the head end of the bed. So aspiration pneumonia is something we should avoid. Patients who have a goiter, and if you give a lot of iodine, it can precipitate thyrotoxicosis. So these are the adverse effects of Lugol's iodine. So we have covered the role of Lugol's iodine in esophageal squamous cell cancer screening, and we also covered how to do it, and we also covered some of the adverse effects of Lugol's iodine staining. I hope this is useful. Thank you.